Welcome back, everyone. You know, establishing care with a primary care provider is an important step for your long-term health. But many of us wait until something goes wrong before seeking care. So joining us today is Dr. Azeez with Lima Memorial's Internal Medicine main campus office to share why now is the time to prioritize your health. So thanks so much for joining us, Doctor.
Thank you.
Yeah, so why is it important for adults to establish care with a primary care provider, even if they feel healthy?
Well, as you know, primary care provider, we typically take care of patients by first checking them out by the way of what we call a physical exam, taking a history prior to that. And if we find nothing really wrong with the patient, we still have to undergo some diagnostic evaluation by lab test, because sometimes things are hidden and then the lab test will bring some things to light. So some basic blood work will be obtained at that time. And when we get a report back, we might actually need to expand the diagnostic evaluation, depending on what the finding is. That is why it's important to check yourself coming to the doctor so we can look at these things.
Yeah, so primary care, it really helps in preventing and detecting serious health conditions early on, right?
That's correct. Primary care, when we look at these things, there are some illnesses, of course, like hypertension that may be in you, and because most patients will actually present themselves until they have what we call end organ damage. So that is why it's crucial to check these things out early on, because once you have an end organ damage, then we have to start dealing with that end organ issues. And that may be kidney failure, that might be heart failure, etc., things of that nature. So it's important to check yourself by coming to the primary care physicians, because we evaluate, treat, and then also prevent the disease as well.
Yeah, so what can someone expect when they have their very first appointment with you?
Well, expectations when you first present, we do, like I said, we do a history and physical. Some illnesses obviously extend even to family issues. So we take a family history because that's also important. As you know, some patients may have family history of, for instance, colon cancer. And because of that, that will make us focus onto that person to make sure they don't have that issue as well. So we take the history, physical, diagnostic evaluation, sometimes x-rays, in fact, to check certain things depending on what is going on with that person.
Yeah, so for that person that wants to, maybe take the next step, how can they reach out and schedule an appointment?
Well, typically they call the office number, which is 419-229-3362. At that point, they will be able to schedule an appointment through that service with us.
All right. Well, Doctor, I really appreciate you coming on the show today, and I really, thank you so much.
You're welcome.
All right, well, don't go away because we have more when we return.